Hello, I'm Eirini Maratou. I'm a researcher from Attica University Hospital, Athens, Greece, and the title of our poster is Mitochondrial Peptide MOTS-c plasma levels in patients with type 2 diabetes and how these levels are associated with resistance to clopidogrel and decreased mortality. Mitochondria are known to be functional organelles, but their role as a signaling unit is increasingly appreciated. In 2015, a small open reading frame within 12S rRNA gene in mitochondrial DNA was described. This small OF encodes a bioenergetic peptide named MOTS-c. MOTS-c acts as a myokine, improving insulin sensitivity and contributing to metabolic homeostasis. Its primary target seems to be skeletal muscle. Lower circulated endogenous levels of MOTS-c are associated with impaired coronary endothelial function, and in vitro studies have shown that MOTS-c improves endothelial function. The aim of this study was to find factors that contribute to a resistance to clopidogrel in diabetic patients. The study encompassed 122 diabetes patients suffering from coronary artery disease. All subjects were under dual antiplatelet treatment with aspirin and clopidogrel. We have measured the levels of beta amyloid and MOTS-c by ELISA and the functionality of platelets by the golden standard method, light transmission aggregometry. When adhesion was over 67%, we set the cutoff point by which we characterized our patients non-responders to clopidogrel. We have calculated oxidative stress by measuring Malone-Dialdi levels in plasma. So, we have sequenced 100 patients by Sanger analysis, and we have only found one polymorphism within the 12S OF. The polymorphism is located just upstream the MOTS-c ORF. We do not know if there is any clinical relevance, but perhaps it works as a docking site for regulatory factors. At baseline, high levels of platelet adhesion over 65% as well as high oxidative stress assessed by MDA were correlated with HbA1c over 7 mg per ml. High levels of beta amyloid were correlated with HbA1c, and low levels of MOTS-c below 176 nanogram per ml were correlated inversely with resistance to clopidogrel. So, in univariable analysis, we found that low levels of beta amyloid below 50 picogram per ml, low levels of MOTS-c below 176 nanogram per ml, high oxidative stress and resistant to clopidogrel as shown by adhesion to ATP by LTA was statistically significant and had high odds ratio. When we perform multivariable analysis, beta amyloid, MOTS-c and resistant to clopidogrel retained their significance with high platelet reactivity having an odds ratio 10.6 and MOTS-c levels an odds ratio 6.5. Afterwards, we want to see if there was any relative risks of these factors with major cardiac events, and we have used crude an adjusted Cox regression analysis and 2 statistical models. Each model was adjusted for different factors, but the fact is that both models gave the same results. High reactivity of platelets, beta amyloid in high levels and low levels of MOTS-c, as well as HbA1c higher than 7 mg per dL have high relative risk factors. So, concluding our study, abnormal HbA1c and MOTS-c levels were associated with resistance to clopidogrel in diabetic with CAD. Resistance to clopidogrel and markers of diabetes were associated with increased mortality at the 2 years follow-up. Thank you for your attention.